Question 1. In the context of pediatric imaging (MS), Adams is reviewing the abdominal CT scan of a 4-year-old child who has been experiencing abdominal pain. Upon analyzing the scan, she notices an anomaly in the area of the spleen which is smaller than typical for this age. What is the most likely explanation for this observation? A. The spleen in children naturally enlarges with age. B. The appearance could indicate a congenital anomaly such as a splenia. C. The child's spleen is smaller than usual because of post-inflammatory reaction. D. The size variation is most likely normal anatomical variant and poses no clinical concern. Answer. Correct answer. B. Explanation. In pediatric imaging, anatomical variations in the spleen can occur. A splenia, a congenital condition, leads to a smaller or absent spleen. This can be identified through imaging and can be associated with other congenital abnormalities. Option is incorrect, as spleens do not naturally enlarge with age in a uniform pattern, and this scenario does not fit a post-inflammatory condition. Option C is incorrect because inflammatory changes would more likely involve an enlarged spleen. Option D is incorrect because such significant variation should not be dismissed without further investigation. Question 2. Based on the information provided, which of the following imaging modalities is most appropriate for identifying the presence of a foreign body in the gastrointestinal tract of a child? A. Magnetic resonance imaging MRI. B. X-ray radiography. C. Ultrasound as D. Computed tomography. C. Answer. Correct answer. B. Explanation. X-ray radiography is commonly used for identifying foreign bodies in the gastrointestinal tract. Radiopaque foreign bodies, e.g., metal objects, show up clearly on X-ray images. MRI and ET are generally not as effective for visualizing non-radiopaque foreign bodies in the GI tract, while ultrasound may be useful in certain situations but is not the first choice for foreign detection. Question 3. Mr. Richards is reviewing a chest CT scan of a 60-year-old male patient with a history of chronic smoking. Upon examining the scan, he notices a lung mass with irregular borders in the upper lobe of the left lung. What is the most likely diagnosis based on these findings? A. Benign pulmonary nodules. B. Pulmonary metastases. C. Small cell lung cancer. D. Primary lung cancer. Answer. Correct answer. D. Explanation. In a patient with a history of smoking, an irregular mass in the lung with such characteristics is most consistent with primary lung cancer. Small cell lung cancer, option C, is also related to smoking but often presents differently on imaging. Pulmonary metastases, option B, would likely show multiple lesions and a different imaging pattern. Benign nodules, option A, typically have smoother borders and are asymptomatic. Question 4. When considering the interaction of radiation with matter, which of the following processes predominantly contributes to the attenuation of X-rays in soft tissues? A. Photoelectric effect. B. Compton scattering. C. Pair production. D. Elastic scattering. Answer. Correct answer. B. Explanation. The Compton scattering effect is the primary contributor to the attenuation of X-rays in soft tissues. This occurs when X-rays interact with outer shell electrons, resulting in a scattered photon and the ejection of an electron. The photoelectric effect, option A, contributes to attenuation at lower energies but is less significant in soft tissues. For typical diagnostic X-ray energies, pair production, option C, have very high photon energies and is not significant in diagnostic radiology. Elastic scattering, option D, is minimal in comparison to the Compton effect. Question 5. Mr. Patel is examining a patient's MRI of the lumbar spine. The MRI reveals a herniated disc between L and L compressing the adjacent nerve root. What is the most common clinical manifestation associated with this finding? A. Pain and numbness radiating down the leg, commonly referred to as sciatica. B. Reduced range of motion in the lumbar spine. C. Muscle weakness in the lower back. D. Complete paralysis of the lower extremities. Answer. Correct answer. A. Explanation. Herniated discs, especially at the lower level, commonly cause sciatica, which is pain radiating down the leg due to nerve root compression. This pain is often accompanied by numbness and tingling along the sciatic nerve distribution. Reduced range of motion and muscle weakness may occur, options B and C, but sciatica is the most common and characteristic symptom. Complete paralysis, option D, would be an uncommon severe consequence of spinal cord compression, which is not typically associated with isolated lumbar herniation. Question 6. Which of the following describes the primary advantage of using a high kVp setting in radiography? A. It reduces the amount of scattered radiation produced. B. It improves the contrast of the image, making subtle features more visible. C. It increases the penetrating power of X-rays, improving image quality. D. It lowers patient radiation dose by reducing exposure time. Answer. Correct answer. C. Explanation. A high kVp setting increases the energy of the X-ray beam, allowing it to penetrate dense tissues, resulting in improved image quality, especially for thicker body parts. This setting also reduces the number of scattered X-rays produced, which can improve image clarity. However, its primary advantage is improving the overall penetrating power of the X-rays, while lower exposure time may result from kVp. Option D. It is not the main advantage. Question 7. When analyzing a ECG of a 55-year-old male patient with a suspected stroke, which of the following features would most strongly suggest an ischemic stroke in the acute phase? A. Hyperdense artery sign. B. Decreased attenuation in a cortical region. C. Presence of a hemorrhagic lesion. D. Generalized cerebral edema. Answer. Correct answer. B. Explanation. In the acute phase of ischemic stroke, areas of decreased attenuation in a specific cortical region, often the area supplied by an occluded artery, are indicative of infarction. This can be seen as hyperdense regions on CT imaging. The hyperdense artery sign, option A, is more characteristic of a thrombus in the arterial lumen, commonly seen in acute ischemic stroke but not as directly indicative infarction. Hemorrhagic lesions, option C, suggest a hemorrhagic stroke, not ischemic. Cerebral edema, option D, can be seen in both ischemic and hemorrhagic strokes but is less specific for early ischemic changes. Question 8. Considering the anatomy of the head and neck, which of the following structures is most commonly involved in an injury resulting from a blunt trauma to the neck? A. Carotid artery. B. Internal jugular vein. C. Esophagus. D. Trachea. Answer. Correct answer. D. Explanation. The trachea is the structure most commonly affected in blunt neck trauma. It is located centrally in the neck and is vulnerable to compression, leading to potential airway obstruction or damage. The carotid artery, option A, and internal jugular vein, option B, can also be injured in trauma, but tracheal injuries are more common and immediately dangerous. The esophagus, option C, is less commonly affected, located posteriorly, and is protected by other structures. Question 9. Which of the following factors has the greatest impact on the spatial resolution of an MRI image? A. The magnetic field strength. B. The coil used for signal reception. C. The matrix size of the image. D. The duration of the scan. Answer. Correct answer. C. Explanation. The matrix size directly affects the spatial resolution of MRI images. A larger matrix size increases the number of pixels, thereby improving the detail and sharpness of the image, while magnetic field strength, option A, and coil type, option B, influence image quality and signal-to-noise ratio. The matrix size is the primary factor determining spatial resolution. The scan duration, option D, influence image quality indirectly but is not as critical as matrix size. Question 10. Under the assumption that a patient is receiving contrast-enhanced CT, which of the following factors will most influence the level of contrast enhancement in a lesion? A. The lesion size. B. The lesion's vascularity and blood flow. C. The patient's body mass index (BMI). D. The administration rate of the contrast agent. Answer. Correct answer. B. Explanation. The vascularity and blood flow to a lesion are the most critical factors determining the level of contrast enhancement in CT imaging. Lesions with rich blood supply will appear brighter with contrast, while lesion size, option A, can affect the visibility of the lesion, is not the primary factor in enhancement. BMI, option C, and contrast administration rate, option D, have some influence but significantly alter the enhancement of a lesion compared to vascularity. Question 11. In the context of MRI imaging, when considering the principles of TNT relaxation times, how would the relaxation times for fat and water compare in terms of signal intensity? A. Relaxation time for water is longer than fat. B. Relaxation time for fat is longer than water. C. Relaxation time for fat is shorter than water. D. Relaxation time for fat is longer than water. Answer. Correct answer. C. Relaxation time for fat is shorter than water. Explanation. TM relaxation times refer to how quickly protons in tissue return to equilibrium after being disturbed by an RF pulse. Fat has a shorter relaxation time compared to water because fat protons experience less molecular motion, leading to quicker decay of the transverse magnetization. This results in a reduced signal intensity on weighted images for fat. Conversely, water has a longer relaxation time, leading to brighter signals in Twait Mora. Question 12. When analyzing a EK of the abdomen, the portal vein is often an important structure to identify. Which of the following is true regarding its anatomical relationship in cross-sectional imaging? A. The portal vein lies anterior to the inferior vena cava at the level of the L vertebra. B. The portal vein lies posterior to the pancreas. C. The portal vein is typically visualized in the left lower quadrant of the abdomen. D. The portal vein courses inferior to the liver. Answer. Correct answer. A. The portal vein lies anterior to the inferior vena cava at the level of the lower vertebra. Explanation. On A. The portal vein is visualized in the region of the L vertebra anterior to the icon behind the pancreas. The portal vein is formed by the confluence of the superior mesenteric vein, SMV, and the splenic vein. It travels towards the liver, carrying blood from the intestines for filtration. Recognizing anatomical relationship is essential for interpreting abdominal CT images, especially in the context of portal hypertension and liver diseases. Question 13. Given the circumstances of pediatric imaging, which of the following statements is true about the radiographic appearance of bone fractures in children compared to adults? A. Children's bones have denser trabecular pattern, making fractures less visible on X-ray. B. Children's bones heal more quickly and typically do not show periosteal reaction. C. Children's bones have thicker periosteum, which results in more significant periosteal reaction in fractures. D. Children's bones are less flexible than adult bones, leading to higher likelihood of complete fractures. Answer. Correct answer. C. Children's bones have thicker periosteum, which results in more significant periosteal reaction in fractures. Explanation. Children's bones have thicker periosteum, which helps in the healing of fractures but also leads to more pronounced periosteal reaction, visible on X-rays. This is key distinction from adult bone fractures where periosteal reactions are less prominent. The thicker periosteum also contributes to the healing process. Pediatric fractures, which generally heal faster than in adults, understanding these differences is crucial for interpreting pediatric radiographs correctly. Question 14. When evaluating the anatomy of the chest in which of the following is true about the relationship between the left atrium and the esophagus? A. The left atrium lies posterior to the esophagus. B. The left atrium is superior to the esophagus. C. The left atrium is anterior to the esophagus. D. The left atrium is lateral to the esophagus. Answer. Correct answer. A. The left atrium lies posterior to the esophagus. Explanation. The left atrium of the heart is located posterior to the esophagus in the chest. This is important in cardiac imaging as enlargement of the left atrium due to conditions such as mitral valve disease or atrial fibrillation can impinge on the esophagus, potentially leading to difficulty swallowing or dysphagia. Accurate recognition of these anatomical relationships is critical for interpreting chest CT scans and diagnosing related pathology. Question 15. Based on the information about the MRI of the brain, which of the following sequences is most effective in differentiating between white matter and grey matter? A. Weighted imaging. B. Diffusion tensor imaging. C. Weighted imaging. D. Proton density imaging. Answer. Correct answer. C. Weighted imaging. Explanation. Weighted MRI is particularly effective in differentiating between white matter and grey matter in the brain. In T-images, white matter appears lighter than grey matter because of differences in tissue composition. Tweighted images also provide useful contrast but are better at highlighting pathology such as edema or tumors. Tweighted imaging is most commonly used for anatomical studies because of its ability to provide clear structural detail. Question 16. When analyzing a EK of the brain, which of the following statements best describes the location of the thalamus in relation to the other brain structures? A. The thalamus lies inferior to the basal ganglia. B. The thalamus lies anterior to the cerebral cortex. C. The thalamus is located superior to the midbrain. D. The thalamus lies medial to the internal capsule. Answer. Correct answer. D. The thalamus lies medial to the internal capsule. Explanation. The thalamus is located medially to the internal capsule in the brain, a key structure for the transmission of motor and sensory information. It lies between the cerebral cortex and the brainstem, with its role being to relay information to and from the cortex. The internal capsule, a white matter structure, separates the thalamus from the caudate nucleus and putamen. Understanding the anatomical positioning of the thalamus is essential for interpreting brain ET at MRI scans. Question 17. Considering the basic physics of radiation, what is the primary effect of an increase in kilovolt kVp on radiographic imaging? A. It increases the patient dose but decreases image contrast. B. It decreases the patient dose and improves the image contrast. C. It increases the image contrast and decreases the patient dose. D. It decreases both image contrast and patient dose. Answer. Correct answer. A. It increases the patient dose but decreases image contrast. Explanation. Increasing the kVp increases the energy of the X-ray photons, allowing for better penetration through the body, which leads to lower image contrast. While it reduces the amount of scatter radiation and therefore image noise, it increases the overall patient dose. This relationship is critical for optimizing X-ray techniques to balance image quality with Question 18. During a routine X-ray of the chest, a radiograph reveals a shift of the mediastinum to the left. Based on this finding, what is the most likely cause of this shift? A. Pneumothorax on the left side. B. Pulmonary consolidation on the left side. C. Left-sided pleural effusion. D. Aortic aneurysm on the left side. Answer. Correct answer. C. Left-sided pleural effusion. Explanation. A left-sided pleural effusion can push the mediastinum toward the opposite side, right side. Pleural effusion, which involves fluid accumulation in the pleural space, displaces the lung and mediastinum. Understanding the physiological causes of mediastinal shift is crucial for diagnosing chest pathology, as conditions like pneumothorax or consolidation would typically cause a mediastinal shift toward the affected side, not away from it. Question 19. In the context of MRI imaging, what is the most likely cause of a loss of signal intensity in tweighted images of the brain? A. Hemorrhage in the brain. B. Edema in the brain tissue. C. Tumor presence in the brain. D. Calcification in brain tissue. Answer. Correct answer. D. Calcification in brain tissue. Explanation. Calcification in brain tissue causes a loss of signal intensity on tweighted MRI images due to the paramagnetic properties of calcium deposits. This phenomenon can be seen in conditions like certain brain tumors, vascular malformations, or aging. In contrast, edema typically causes increased signal intensity on tweighted images, while hemorrhage can lead to variable signal chain, depending on the stage of the blood breakdown products. Question 20. Under the assumption that a patient has a history of prostate cancer, what is the most relevant imaging modality to assess the extent of local disease and pelvic lymph node involvement? A. X-ray of the pelvis. B. Abdominal ultrasound. C. CT scan of the abdomen and pelvis. D. MRI of the pelvis. Answer. Correct answer. D. MRI of the pelvis. Explanation. MRI is the most effective imaging modality for assessing local disease spread and pelvic lymph node involvement in prostate cancer. It provides high-resolution images of soft tissues, which are crucial for evaluating the prostate and surrounding structures. CT may also be used, but MRI offers superior soft tissue contrast for detecting small lesions, lymph node enlargement, extracapsular extension of prostate cancer. Question 21. In the context of mammography, which of the following features would most likely indicate a benign breast lesion? A. Irregular margins with high density. B. Smooth, round, and well-defined borders. C. Spiculated margins with microcalcifications. D. Increased vascularity with heterogeneity. Answer. Correct answer. B. Smooth, round, and well-defined borders. Explanation. Benign breast lesions typically present with smooth, round, and well-defined borders. These features are more indicative of cysts or fibroadenomas. In contrast, malignant lesions often exhibit irregular, spiculated margins with associated microcalcifications, which may indicate the need for further evaluation. Question 22. When performing an EK of the abdomen, which of the following structures is most commonly identified using intravenous contrast to evaluate its anatomy? A. Gallbladder. B. Pancreas. C. Kidneys. D. Aorta. Answer. Correct answer. C. Kidneys. Explanation. Intravenous contrast is commonly used in CT scans to enhance the visibility of the kidneys, particularly for assessing renal tumors, hydronephrosis, and other renal pathologies. The kidney's vascular structure and function are clearly depicted with contrast, aiding in the detection of abnormalities. Question 23. Which of the following MRI sequences is most useful for visualizing acute ischemic stroke in the brain? A. Tweighted imaging. B. Diffusion-weighted imaging TWI. C. Tweighted imaging. D. Fluid attenuated inversion recovery flare imaging. Answer. Correct answer. B. Diffusion-weighted imaging TWI. Explanation. Diffusion-weighted imaging TWI is the most sensitive MRI sequence for detecting acute ischemic stroke. It highlights areas of restricted water diffusion which occur in the early stages of ischemia. This is typically seen within minutes to hours of the stroke event, providing critical information for diagnosis and treatment. Question 24. In the evaluation of lung cancer on CT imaging, which of the following findings would most likely be suggestive of a malignant pulmonary nodule? A. A smooth, well-circumscribed lesion. B. A nodule with central calcification. C. A nodule with irregular, spiculated margins. D. A lesion with homogeneous density. Answer. Correct answer. C. A nodule with irregular, spiculated margins. Explanation. A malignant pulmonary nodule often presents with irregular or spiculated margins, indicating the possibility of a primary lung cancer or metastatic disease. Benign nodules are more likely to have smooth and well-defined borders or central calcification, which are features that make them less likely to be malignant. Question 25. What is the primary mechanism that accounts for the difference in signal intensity between white matter and gray matter MRI? A. The difference in proton density between white matter and gray matter. B. The different water content in white and gray matter. C. The myelination of white matter fibers. D. The blood-brain barrier permeability in white matter. Answer. Correct answer. C. The myelination of white matter fibers. Explanation. The primary factor responsible for the difference in signal intensity between white and gray matter on MRI is the varying degree of myelination. White matter has a higher concentration of myelinated fibers, which decreases the signal intensity on tweighted images due to the faster relaxation times of myelinated tissue. Gray matter, with less myelination, appears bright on tweighted images. Question 26. Which of the following is the most common radiographic feature seen in the early stages of osteoarthritis? A. Joint space narrowing. B. Bone sclerosis. C. Erosion of joint margins. D. Periosteal new bone formation. Answer. Correct answer. A. Joint space narrowing. Explanation. Joint space narrowing is one of the earliest and most common radiographic features of osteoarthritis. It reflects the loss of cartilage in the joint, leading to decreased space between the bones as the disease progresses. Additional features like subchondral sclerosis, osteophytes, and joint deformities may develop. Question 27. On a chest X-ray, which of the following findings is most consistent with the presence of a pneumothorax? A. Hyperinflation of the lungs with a shift of the mediastinum toward the affected side. B. A visible pleural line with absent lung markings beyond the line. C. A consolidation in the lower lung zones with no shift of the mediastinum. D. Diffuse reticular opacities throughout both lung fields. Answer. Correct answer. B. A visible pleural line with absent lung markings beyond the line. Explanation. A pneumothorax appears as a visible pleural line with no lung markings beyond the line, indicating the presence of air in the pleural space. This may be accompanied by lung collapse and a shift of the mediastinum toward the opposite side, but the primary diagnostic feature is the pleural line without lung markings. Question 20. In the assessment of a pelvic mass using ultrasound, which of the following characteristics would most likely suggest a benign ovarian cyst? A. Solid, heterogeneously echogenic mass with irregular borders. B. Well-defined anechoic lesion with smooth borders. C. Complex cystic mass with septations and calcifications. D. Solid mass with vascular flow on Doppler ultrasound. Answer. Correct answer. B. Well-defined anechoic lesion with smooth borders. Explanation. A well-defined anechoic lesion with smooth borders is characteristic of a benign ovarian cyst. These cysts typically contain clear fluid and have simple, smooth edges without signs of malignancy such as internal echoes, septations, or calcifications. In contrast, more complex features may suggest malignancy. Question 29. Which of the following MRI findings would most likely be indicative of a brain tumor? A. A uniform, homogeneous mass with well-defined margins. B. A lesion with irregular borders and heterogeneous enhancement after contrast. C. A lesion with uniform enhancement but no surrounding edema. D. A lesion with diffuse symmetric distribution across the brain. Answer. Correct answer. B. A lesion with irregular borders and heterogeneous enhancement after contrast. Explanation. Brain tumors typically present with irregular borders and heterogeneous enhancement after contrast administration, reflecting areas of necrosis, vascularity, and cellular activity within the tumor. Homogeneous enhancement is more common in benign lesions, while symmetric lesions may indicate diffuse processes like encephalitis or metabolic disorders. Question 30. In the context of pediatric imaging, what is the primary reason for using a low-dose CT scan technique when evaluating a child for suspected appendicitis? A. To reduce the exposure to ionizing radiation. B. To improve image resolution for detecting small bowel loops. C. To avoid contrast-induced nephropathy in children. D. To enhance the visualization of the colon and rectum. Answer. Correct answer. A. To reduce the exposure to ionizing radiation. Explanation. The primary reason for using a low-dose CT scan in pediatric imaging is to minimize exposure to ionizing radiation, which is a particular concern in children due to their developing tissues and higher sensitivity to radiation. When diagnosing conditions like appendicitis, low-dose protocols help maintain diagnostic accuracy while reducing radiation.